Health clinics rely on information systems to improve efficiency, service quality, and financial accuracy. The conversion cycle transforms inputs, medical supplies, staff, equipment, patient data into healthcare services, consultations, treatments, and diagnostics. A well-designed AIS supports daily operation, cost tracking, and management decisions. This study examines the clinic's procedures, documents, and information flow, highlighting internal control weaknesses and recommending improvements for efficiency, reliability, and data security. Effective data processing ensures accurate financial reporting and informed decision-making, demonstrating the importance of a controlled conversion cycle in healthcare. Clinic Dr. Suraya was founded in 2006 by Dr. Suraya Sahad, who brings over 20 years of experience in patient healthcare. Conveniently located in Bandar Baru Bangi, the clinic is solely owned and operated by Dr. Suraya, who oversees all daily operations. The clinic provides comprehensive medical care for children, adults, and seniors with a special focus on serving the Bangi community. Recognizing the importance of continuous and reliable healthcare, the staff treat every patient like family, delivering compassionate and professional services. Clinic Dr. Suraya offers a wide range of medical services, including routine checkups and ECGs, pre- and postnatal care, and 2-day pregnancy ultrasounds by appointment. Additional services include family planning, minor surgeries, nebulizer treatments, X-rays, and immediate blood testing. By providing these services, the clinic ensures convenient, reliable, and high-quality healthcare for patients of all ages.
Let's move on to the next part, which is about conversion cycle activities, procedures, and documents. Okay, so this slide explains the conversion cycle activities in the clinic. The process begins when a patient visits the clinic, either as a walk-in or through an appointment. During this stage, personal information is collected and new patients are registered into the system. For existing patients, the clinic will retrieve their records and record appointment details accurately. This ensures that all patient information is up to date. Overall, these activities help maintain accurate records and ensure a smooth and efficient patient flow in the clinic. Now let's talk about the procedure of medical assessment and diagnosis. Okay, the process begins with the initial assessment where a medical assistant or nurse records the patient's vital signs such as body temperature, blood pressure, and weight. This helps gather basic information about the patient's current health condition. Next is the symptom review. During this stage, the patient is asked questions by the doctor about their symptoms and overall well-being to identify any potential health issues before the doctor's examination. After that, the doctor examination takes place. The doctor reviews the patient's medical history, reported symptoms and previous treatment records, and conducts a physical examination to assess the condition more accurately. Finally, the last one, if necessary, diagnosis tests are performed. Additional tests such as blood pressure tests, imaging, or laboratory investigations may be requested to confirm clinical findings and ensure an accurate diagnosis. So, what's the documents or records used in the conversion cycle of the clinic? So, the first one is the patient registration form, which is used to collect basic information such as the patient's personal details and medical history. This form helps create the patient's medical file and make sure the patient can be identified correctly. Next, treatment notes are written by doctors or medical staff during or after the consultation. These notes record what the doctor finds, what the treatment is given, and how the patient responds. They are useful for future visits or follow-up care. So finally, the medical record or patient file keeps all important information in one place, including diagnosis, treatments, medications, and follow-up notes. This helps medical staff track the patient's condition over time and provide continuous and proper care. So, there are another two examples of documents that used in the confusion cycle, such as prescription slip, which is issued by the doctor to authorize medication dispensing. Means that it has details about the medication that the patient needs. So, the last one is reports, which is includes laboratory test results and imaging findings such as X-ray. This provide objective evidence to confirm medical diagnosis and supports accurate treatment planning and clinical decisions for the health of the patients.
Next, I will explain system flowchart in conversion cycle. In this topic, we will go through with three processes. First, patient registration process. The process starts when the patient arrives at the clinic. At the registration counter, the receptionist collects the patient information and enter into the system. If the patient is new, a new record is created. If the patient is an existing patient, the system retrieves the existing record. Then, the system generates a queue number. Second, treatment or consultation process. The doctor retrieves the patient medical record and examines the patient. The diagnosis and treatment details are updated in the system. If the medication is required, the doctor generates an electronic prescription. Third, medication dispensing process. The pharmacist will receive the electronic prescription, verify the details, check medication availability, and dispense the medicine. The system will update it to record the medication issued and adjust inventory level. Information flow between department and management system. The information flow begins at the registration counter, where patient details are entered into the system and stored in a central database. This information is accessible to authorized staff. Next, the information flows to the medical department. Doctor and medical assistant access patient record to review medical history, record diagnosis, and update treatment notes. Any test results are also saved in the system. After that, the information also flows to the billing and accounting department. Clinic administrators use system generate reports to monitor clinic performance, patient volume, revenue, and inventory level. Lastly, the information flows to the pharmacy. The pharmacist will receive the electronic prescription generated by the doctor. After dispensing the medication, the pharmacist updates the system, which automatically adjusts the inventory record. Overall, the integrated information flow ensures accurate record, reduce error, and support efficient clinic operation and better managerial decision making.
Next, I will explain about the systematic accounting system for the conversion cycle and its application in Clinic Dr. Suraya. First, an accounting system is used to record and manage your business financial information to support decision making and financial control. The type of system used depends on the size and the nature of the business. In Clinic Dr. Suraya, the patient management system, which is Medex One Global, record important data such as the volume of service, type of treatment, and medicine usage per patient. This data help the clinic to reduce medicine wastage, improve treatment traceability, calculate cost per consultation, and allocate staff time based on treatment type. Key functions of this system include recording financial transactions, financial reporting, cost control, pricing decision, budgeting, and regulatory compliance. Next is performance measurement in the conversion cycle. The cash conversion cycle measures how long it takes to convert operation into cash and evaluates working capital efficiency. Operational performance is measured using waiting time from registration to consultation and turnaround time from diagnosis to treatment completion. The automate system help identify peak hours and patient flow, improve scheduling and efficiency, and monitor delay in clinic performance. Service quality indicators include accuracy of medical records, reasonable waiting time, and efficient and professional treatment. For fraud control, the system can detect false identities, prevent duplicate patient registration, and link patient record using photos and medical history. In managerial decision making, accounting data support pricing decision, cost control, and resource planning. Cost accounting and activity based costing help identify the true cost of service and allow the clinic to set appropriate price while balancing profitability and competitiveness. Accounting data also help identify exercise medicine usage and operational efficiency and support cost reduction without affecting service quality. In conclusion, the conversion cycle is important for improving operational efficiency and financial health. By managing it effectively, Clinic Dr. Suraya can improve cash flow, reduce bottlenecks, and enhance service delivery. Overall, a systematic accounting system supported by performance measurement helps the clinic operate efficiency, strengthen financial control, and ensure long-term sustainability. Thank you.
In Clinic Dr. Suraya, we identify two major internal control weaknesses in the conversion cycle. First, inadequate segregation of duties occurs because staff often perform multiple critical roles such as registration, billing, and inventory management. This increases the risk of errors and reduce accountability. Second, there is a lack of treatment authorization documentation. Some treatments are initiated without proper approval, which can lead to medical errors, inconsistent care, and weak audit trials. Together, these weaknesses affect patient safety, operational efficiency, and financial reliability. To address these weaknesses, we recommend several measures. First, clearly segregate duties so that no single person handles multiple critical tasks supported by regular managerial reviews. Second, establish standardized treatment authorization processes, ensuring all procedures and prescriptions are approved and documented. Third, adopt an electronic medical record system which secures patient data, tracks inventory, and creates audit trails. Finally, provide staff training and conduct regular audits to reinforce proper practice and maintain high standard of care.